Commissioner Harris,
Here.
Commissioner Hearns, Commissioner Kiefer,
Present.
Commissioner Mayshore,
Present.
Commissioner Mohammed, Vice Chair Moulton,
Here.
and Chair Derryberry.
I'm here as well. And
We
it
have a quorum.
doesn't look like we have Rob here for the invocation. So Lisa, could you mind leading us in invocation?
Sure. Yeah.
It'd be fantastic. Please stand.
Heavenly Father, we just thank you for today, Lord. I just ask that you be with us in decisions that need to be made, and just give us wisdom in all that we do. Just thank you for everyone on this board. In your name we pray. Amen.
Amen. And remain standing and face the flag. Place your hand over your heart and repeat after me.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. I'm going to guess that we do not have any public business from the floor, given our lack of attendance here today. So we'll go ahead and move into our consent calendar. We have our minutes from our September meeting since we were dark in October. Has everyone had the opportunity to review the minutes? So I'll entertain a motion.
A motion to approve.
A second? I'll second. How about that? All in favor? Aye.
Aye.
We can vote vocally. Aye. Any opposed?
I wasn't here, so I was staying.
Okay.
Me too.
Yeah. You don't have to now.
So we have 3 in favor and 2 abstentions, and so the motion carries. So that will move us on to Michelle's presentation on the Community Wellness Education Program. Michelle, you're more than welcome to stay there. You don't have to go to the podium unless it's better for the PowerPoint.
Yeah.
Okay,
Do it together.
perfect.
I won't make her stand up there all by herself.
Thank you.
Thanks. So, it's weird being on this side of the podium now, but, so I just wanted to kind of give you a little bit background first before we go into the presentation on the CareScope product provided by Civic Health to where we've been in the last couple of years over this program, and we feel pretty strongly about it, and we keep pushing it and presenting it to people because hopefully someday we'll have this kind of system in our community because we really believe that it would be helpful. So the CareScope product is it's a computer-based program, web-based, that basically looks at all referrals into social services and health facilities, and it provides a case management program that will really kind of help fill gaps, especially help patients and clients of ours in the community be more compliant and help us case manage together when we refer a client to, like, let's say the clinic refers a client to our home visitation program. And so in this type of system, which we'll kind of go through where they come from and where they've been, but in the system, basically, they would refer to our organization through a computerized system, and then the case managers in each organization could follow the patient and discuss what's going on and things like that. So it kind of, instead of giving a kind of cold handoff, even a warm handoff to another agency, once you do that referral, you have no idea if the patient's going to the doctor, are they, if they have high blood pressure or diabetes, are they following up, are they going to their diabetes classes and things like that. So when Patty and Calvin came to me about maybe looking at some kind of education program, that would tie in the asthma and all the other health disparities that we have. This was the first kind of thing that I thought of. And so they've already had the presentation from the actual company, but we decided our next step would be us kind of presenting. So this isn't our, we're not experts in this. Tiara actually has had the presentation given to her probably 15 times now. But so it's more of just kind of presenting it to the commission here and seeing how we feel about it, how you all feel about it. Is it something that we want to take to the next step to present to the mayor and the administration staff here at the city and see if we want to move, and the doctors and the other medical practices and social services, because it is really going to take buy-in from the whole community to make it work. So to start, do you want to kind of go through this part of it?
So, like Michelle said, it bridges the gap between healthcare providers and social services. It also provides for cost effectiveness because you're not holding the client fully responsible, because there is a way to track. So let's say, like Michelle said, I go to the clinic and they go to a class. That class teacher is able to say such and such came to this class, and it can be sent back to the provider that referred them. So it's more of like a universal,
Continuum of care.
thank you very much. And it can track the population's health and individuals. So you can track individuals, and then you can also get facts for the whole city. It addresses the most pressing issues, clinical and non-clinical. And this product has been around for almost 10 years. It's been utilized in 34 different communities, about 4,500 users, and about 690,000 lives have been touched by this particular system. So this is kind of where the system is being used today. Civic Health is based out of Tennessee, so a lot of the East Coast uses this system, and it's very, you can create however, you can, give me words, it can be created to what you want it to do. So since it's an online base, if you only want to, thank you, you can customize it to the community and what you want to change, what you want to track. So it's not like every community looks the same, because that's not how it is. So the only other community that use it is this Providence, which is pretty big. We don't know exactly how they're using it because we weren't given that information, but they are one of the
And two of the Providence communities, which is hospital-based, so one in North Hollywood and one in San Fernando that we know of. So it is growing.
So again, it goes into clinical and non-clinical. It blends evidence-based and contextualized action plans to tackle a client's needs. So it's very individualized. Addresses shifting reimbursement models that require a measurement of continuum of care. So that's that whole continuum of care for each client. Manage shrinking reimbursement margins, applies limited resources to those most at risk, and increases productivity and improves results on case management staff. So this is how you can use it in the clinical components on the left-hand side. So you can do disease management, mental health, and specialty care management. You can track how many medicines a person is taking and where each medical home, which particular patient is, if they're at the clinic or if they're at Kaiser, if they're at whoever is using this particular system. And it has the ability to interface with all the different feeds.
Databases.
Yeah, different databases that each provider uses.
It's also really helpful because we wait for years to get our statistics and how we've improved or if we've made improvements in the community, and this way it's real-time statistics for us. So we can look at all of our, everybody who has diabetes and their BMIs and A1Cs and implement programs and then see all those people that have gone through those programs and the impact that they have had on them. So it really gives us a real-time tracking of what we're doing right and what we're trying to do, and maybe it's not working, so how can we tweak it or figure out why it's not working to have a better impact in the community.
So again, it works in different environments. Like Michelle said, you have to have the buy-in of all different sectors, so nonprofit CBOs, local clinics, hospitals, local government, whoever we can potentially refer to. You want to have all the players involved so that we can have like Michelle said, real-time data. So you can track individual and population health, the ability to plug gaps in services, and support management of patient risk cost. So this is kind of what it can touch. So your community resources, not just medical, like it said, it's non-clinical, so you can, for example, refer somebody to Grace Resource Center and then make sure that they actually, or if they went for food or clothes, to make sure that they actually receive those services and get that referral back if you're referring to them. Faith-based communities and schools.
And even for, like, we've worked with the youth court system here. We've started a referral system here for youth court to the clinic for health assessments and mental health assessments for the families. And we're even looking at putting together parenting classes and classes for the kids that are going through youth court. So, but we need, it would be nice to have some kind of mechanism for the court, especially because it's mandated. Like, did they go? What were the results? What's going on? So there's a connection there and a gap that could be filled.
So, like I said, it does track your population health, which you can manage multiple wellness and intervention programs. The care coordination, which is your clinical and non-clinical resources by individual based. It can work as a patient navigator, so it can help patients navigate the system. And it also has a community resource directory, so a non-user, like a community resident, can go on in and say, is that better? Is that better? Okay. Like a non provider, so a community resident could go onto the system and just plug in certain information about themselves, and they could find out what services they qualify for. So if they're low income and they can qualify for Medi-Cal, we can build those referrals within the system, so it could tell them what programs that they qualify for just by logging in, just putting in their information.
So one of the gaps in our community that we've all tried to do for the last, I don't know, it's forever, as long as I can remember, is our Red Book or our community-based directory of services. And this kind of takes that away from that, because everybody would be in the system, and like Tiara said, this is the cool part of this system that I really like, is, and it's all HIPAA compliant. In other states, they're using, public health even is using this system. So, so there is the HIPAA compliant part, but there is a guest login that we can have to all of our websites or wherever, that somebody could go into the system, put in all of their different income levels, family, households. They could do a drop-down box and choose what they want. Do they need housing services? Do they need clinical services? Do they need parenting classes? Whatever. And it will give them all of the services in the community that they would qualify for, and then they could do a self-referral right from there into that program. But also they could just go on and look at the different community resources, and that's for anybody in the who's using the system. So if Catalyst needs to send somebody somewhere, they can go in and actually look at all the resources in the community, and it's the responsibility of the users or the services that are provided to kind of go in and put that information in. So it's a real-time resource directory for our community, which is so needed.
So this is just an example of Cincinnati Healthcare Access Network. This is what they use it for. They do care coordination, and then they have referral management, prescription enrollment, and care transitions. So they use it for pregnancy, medical home, ED care coordination pathway, and chronic disease. So this is how they customize the system to work for them.
And just there is a page in, right before that in this. It's not in that slides for some reason, but it shows how some of these others, like the cost savings. So in Florida, they started using it in 1 year. They had a 20% reduction in non-emergent ED visits, and $800,000 in avoidance savings for the ED. So there is a true cost savings to it in being able to navigate these patients to the appropriate services that they need instead of them going to the ED or going somewhere where they don't necessarily need to be. It helps to navigate them through systems, which saves costs, especially for readmissions and things like that, that the hospital is going to be having to deal with now with Affordable Care Act and things like that. And so you can also set up, the system is customizable. So what Tiara is showing you here, the first one was basically a community-based organization type situation, that the community-based organization was kind of like the hub that brought everything together. And then this is more of a county took over the referrals and the process of it. And then they do have other situations like hospitals, things like that, that are using it for different things. So these are just the different ways that they can do the system that it fits the needs of whatever community they're serving. That's it? Good. Okay. So I hope that wasn't too confusing for everybody. We've always kind of talked about this kind of community-wide referral process, I mean, for 15 years or whatever since I've been in the community. And it would be very innovative if we could pull this off as a community, because I don't think a lot of communities are being able to do this. But I feel like with this city, especially the city of Lancaster, and all of our partners, the collaboration that we have in this community, that if anybody can do something like this, that would be extremely beneficial. It would be good to seriously look at it. So
What's the cost?
The cost is, we got a quote a long time ago, but there is more of a setup cost to it of, they had it was $3,500 for 5 licenses for the different community core, care population, and then population health licenses. So I don't know if every single agency would need each one of those licenses or how that would break down. And then the ongoing cost of it is about $1 per life in the system is, I think, how I understood it. So if we had 100,000, all of Lancaster residents or something, it would work out $1 per person is how they explained it. And that's depending on how many, that pricing could go down. So it would take buy-in from, we would have to look at, it would be one of the barriers that we would have to look at, obviously, is the cost. But we could, maybe have a membership fee or something for agencies to be part of it, or somehow try to work that part out of it. And that's honestly why we don't have it yet, because that is the barrier we've faced this whole time, is the cost of it. ABPH can't.
And this is volunteer, right? The agencies would volunteer to be a part of it. They aren't mandated, and the people aren't mandated to be a part of this. That's needed.
Yeah.
See, I think from my perspective, when we look back at what we tried to do at the considering the Asmopolis program, not to discredit it, but I just didn't think it would work for our city. From my connection with the hospital, obviously, given my wife's on the front lines in the emergency department. I hear the stories about the repeat offenders, or so to speak, or the people that are there because they don't know where else to go. And it's not that the doctors in the ER don't know to send them to the various clinics, but there's no follow through. There's no follow up. I think at the city, and I think that. I think that the medical community specifically would probably buy into something like this if it does work as well as your presentation leads it to work, which I'm sure that's the goal, is that they hand out these things and make it look like it's perfect. But I think something like this would work better for our community, knowing how much trouble the emergency department gets in at Antelope Valley Hospital. The Antelope Valley Community Clinic is inundated. Kaiser's urgent care is inundated. Kaiser obviously is a little more self-managed and that sort of thing. But, I imagine that the Catalyst Foundation gets repeat questions, and the resources aren't necessarily there. As much as we all know who to work with, we know we can call ABPH and Catalyst and Grace Resources. But if you can give somebody basically some detailed directions, something that's already laid out here. This is something I think that that we should investigate more. Do you know? Can we get somebody from the company out here to show us a little more? Maybe do a Skype presentation if they're in Tennessee.
Definitely do a Skype presentation. I mean, they've done it for us literally like probably 15 times in the last 5 or 6 years. So, and
would it, Michelle? Do you know if let's say if you guys bought in to work with the city and Kaiser and these various other organizations, would each one have to pay the fee, or would it be like, hey, this is a City of Lancaster deal, and it's something we can then disperse amongst the groups? Because I think that would be important. If we can go to if we had an idea, we figure there's going to be a 50% participation rate. We've got 150,000 citizens, give or take. So we got 75,000 people potentially, or whatever it is. How much is it going to cost with 5 organizations on board? I mean, is that something they could probably give us an idea of?
I think so too. Yeah.
I mean, because this is something that obviously that will help. That would help the city, ultimately help the neighborhoods. As you said, there's 5% of the population are the ones that are the repeat emergency department visitors. They're the people that don't know where to go, and they're the reason why our healthcare costs are so high.
Right.
That's if we all look back to what we heard when we had those kind of symposiums with the various healthcare providers when we were going through the Asmopolis presentations. I think if they were there for this, they would be a lot more excited than they were for what that program provided for the community. So who else has seen this besides you?
Some of the CBOs have seen it because that's where we were originally trying to start it. So Children's Center has been in on presentations on it. Children's Bureau, First 5 LA we've presented to.
Black Infant Health.
Black Infant Health. We've actually even sent this product to the County of Los Angeles because they always talk about this continuum of care, universal case management program. So we've sent it to them as well. And I agree, Stephen, because I've been working with the hospital. I'm working right now on doing kind of assessment of all of our clinics, or everybody that's providing care to our underinsured or uninsured populations, because just in the clinic alone, last month they saw 9,000 visits in 1 month. And when I was talking to Jack Burke at the hospital, he's like, well, we probably have at least 1,000 non-urgent visits in the ER in a month. Okay, so that's 10,000 now. How many is Catalyst seeing? How much is Bart's Altadena and Tarzana Treatment Center and the county? So what are we, 15,000, 20,000? What are we seeing each month, and why? Is it diabetes? What are our top 5 that we could start getting education and things out there to start addressing it? So this would provide the data to be able to figure that out, and it would provide resources back into the community to refer people to right there, and have a backup follow-up system to make sure that they're complying and going to their nutrition classes or taking their medication. They have prescription modulars in here so you can track prescription uses and things like that as well. So it starts really becoming, if they get discharged from the hospital and things like that, that we can really start making a difference in people's lives instead of trusting or hoping that they are going to education classes and things like that can really make differences. And if we really want to make a social change in this community, how we all envision, we need some type of products like this, I think, to be able to do that.
I think that now that we've gotten through the Unite part of our year, that I think this is really a perfect time for us to kind of embark on a new adventure. So what I would say is that if unless there's a competing product that we can kind of consider as well, I think we should look at, because this in my opinion at least is something that I think everyone was trying to get to. Hey, how do we connect what we all have to put our resources in one bucket so that when you can go and pick from it as you need without being overly confused or, so everyone talked about education. This is a piece that can provide that. I have this problem. What do I do? Okay, well, you drop the menu down and, you're going to call Catalyst Foundation for that. They'll provide you with these resources, and then they go to see the Catalyst Foundation, and then they'll upload this information into the computer, and then the person that's tied to that patient or client is going to have all of that there, as opposed to what happens now. Doctor, physician, or provider will dictate something, and hopefully it gets to the person it's supposed to get to, and it just gets stuck in a file somewhere or in some kind of electronic medical records.
A big list of
Yeah.
overwhelming information that they're supposed to weed out and pick out who they want to call. A lot of them
Yeah.
don't.
I mean, the lack of education, I think, is what causes the problems in the healthcare stuff. So, I mean, this is something that we can kind of bridge that gap and educate them slowly, hopefully at a cost not heavy to the community. Then, something we should consider.
Is this something we could facilitate a meeting, maybe with, like we did with the doctors? Maybe bring some folks in and do the Skype presentation or something, and
Sure. Oh, go ahead.
ahead.
I was going to say, Kelvin and I actually met with Michelle. We talked to CareScope and kind of got an idea of what they do, and that was something that they offered to us. They said they would be happy to come out, or at least happy to do a Skype presentation for anybody that was interested. And so Kelvin and I can work on that, and we can determine who we want to invite to that. If we want to keep it, just with the commission for now, or if we want to invite CBOs, or how we want to do that. But I think that's a great idea, and we can definitely work on that.
I love it. I think it's great because it seems really comprehensive and kind of holistic. It sounds like you can add a lot of things, whether it's education or other social services and different things. I wonder about from a kind of day-to-day practical standpoint, as far as now there's one system, the HMIS system, right? We're familiar with that, and it's a database system, and some programs require input of data into that system. So would this I know you said that this interfaces with different systems. I have a hard time comprehending how for example, the HMIS system and this could communicate with each other and stuff. But might this be another? So my case managers are going to enter stuff into HMIS for a particular program, but then they're also. Could this be an additional thing that they're going to enter information into?
Well, there are barriers to everything, and we know that. So we know that's a barrier, is the how-to.
Not that it wouldn't be worth it, but I just want to understand.
But, so there's that. The other thing, so that is definitely a barrier. I mean, we have no idea how all the systems could feed into it. It seems like, yes, it can, but again, I don't trust technology that much sometimes. So they could have one designated person in an agency that just, helps enter that. The other good thing about this, though, that we have to think of workflow-wise, is that it really starts becoming a universal intake. Mm-hmm. So when they come to Catalyst, instead of having to fill out all the same information that they filled out at ABPH that we have to get, it's in the system already. So you already have all of their demographics, all of their income levels, all of their information. So that intake process starts becoming reduced on the workflow part of it. So we're hoping that the entry part maybe isn't as much when somehow we could get the systems to work together. I'm not really sure, but the physical sitting and interviewing people probably will be reduced in time-wise anyways.
Yeah.
So that's another thing that we've talked about doing for years, is trying to get some kind of universal intake instead of, when we refer them to...
And every one of us are redoing the same information over and over. Right. So if they come to us and it's just about housing case management, then we already have all their basic information, other information, and we just focus on answering or inputting that information.
Right.
My concern, I think it's great. My concern is cost. Is there a way for us to identify how the other areas, the other states that have several of them in place, how it's paid for? In other words, is Kaiser playing a part of it? The city of Lancaster pays a part of it. Various organizations pay a part. Because, I'm sitting here listening to the numbers, and I understand what you're saying about it being reduced the more people you get involved. But anyway I look at it, you're looking at $20,000 a month minimum. So my concern is, how is that all split up and who pays for it?
Yeah, and that's how I would kind of envision it, is like everybody who's in it and using it, because I think it will be beneficial for everybody, that they pay a piece depending on budget levels maybe, or something like that. We figure some way out. There is possibilities that we can maybe look at grant funding for some of this, at least at the initial, like the setup of it, that we can, we actually, it was originally in one of the Best Start plans that never kind of went forward, but so we can look at maybe there might be some grant funding for a startup, especially if we had the City of Lancaster, the hospital, Kaiser, High Desert Medical Group, Antelope Valley Community Clinic, and all the CBOs kind of together on one big project. That might look very, attractive to a funder to do a startup on that. So
That would be my number one concern. The other is security. With all this different data out there, with all these organizations, I know if I was looking to sign up for something like that, that's the first thing I'm going to ask myself is who's going to have access to this and what kind of firewalls and things like that are in place.
And we already kind of have a little bit of that we all have to deal with, that if we're sharing it, if somebody joins the Welcome Baby program with us or one of our home visitation programs with us, they have to sign, and then we refer them to somebody else. They actually have to sign a release of information sharing between the organizations, and we have all the different organizations listed. So when so if this comes into play, that's one of the ways that we can kind of deal with that, is that they sign off right there on any services that they might be, that we would be sharing information with, or vice versa.
And if it's web-based, does that mean you never actually own the program? You're constantly just paying for monitoring?
And just going back on what you said, you can also customize it to where if you only want, for example, Grace Resource to see this, that's all they'll see. So, like, if you don't want everybody to see the whole profile information, you can make it to where not every user has those permissions. Just...
No, and I'm in the process of doing that with my own business, going to a different program that's web-based, and I'm tiptoeing through it, and I don't like the feel of it, but that's the way of the world. I've kind of got to accept it.
Yeah,
the clouds in the sky. And
Yeah.
a lot of the data systems that the clinics are using right now are web-based. They're a lot of the electronic medical record systems that are out there right now are web-based in this kind of same process and built-in HIPAA compliances behind them. So it doesn't make sense to me. I don't know how they do it.
No, it's
but
everything I research says that's the way it's going, and
All my stuff in my office is going cloud-based. All the forms. There's nothing on the computers anymore. It's all web-based. You draw all the forms down for the court and everything. It's the way of the world. I think, for not to say that this has to be the program that the city buys into, but what I would like to see, and if we, if there's an agreement amongst us, is that I think we've got the Unite program, unless we can creatively come up with something that is different than that, provides neighborhood services. I really like the idea of going into the health aspect of what we can do in the neighborhoods and in this community. And if this is a way to do all the things that the medical community kind of was concerned with, then we should consider it. So what I would like to do is see if we can get something on the calendar, either regularly scheduled meeting or a special meeting. Maybe if a few of us attend with some of the our CBOs and the medical community, send the invitation to the hospital. The hospital has a new CEO, I think they announced. Maybe it'd be a good time to discuss some of this with him. Get maybe the ER doctors and that sort of representation there, and talk about it. Maybe this isn't the direction that other people think it should go. Maybe it's something else. But without the community involvement, which was, as much as we try, clearly we don't get that here at our meetings. So I think we've got to go out to the stakeholders to get an idea on really what they want. So, I'm not in the community. Michelle seems to really like it, this program that is. So, but maybe other people, maybe you'll be overruled. So, let's see how it works. Let's see how it could be used, and then let's see if we can start implementing something that by the time we get deep into Unite, we've got something working. So we feel like we're, getting some tasks accomplished. So.
I definitely think it's worth pursuing. And I would like to have a situation where if we got to the point we had a Skype meeting, we had a gathering before that to discuss and do some brainstorming so we really know the questions to ask so we can walk away really informed before we go to the next level.
Yeah, because I think, unfortunately, given as peculiar as the Asmopolis program was, I think it took us a long time to really truly understand what they were doing. And we had them. They came out here and gave their presentation. They gave us their pitch, and I just think it just didn't work. I'd hate to, I know these people are in the business to be in business, but, I don't want to waste their time as much as I don't want to waste ours either. So, let's, maybe, we all have good notes and memory as to what the issues were when we had the Asmopolis meetings with the stakeholders, what they wanted to see in the community, which I heard a lot of education, a lot of follow-through, something that's not there currently, and if this is one of those, if this is something to fix that, then let's consider it. If not, let's move on to the next one. I think that there's a lot of CBOs, a lot of, the medical community is very large, and if we can get everyone to buy into one thing, I think it's going to be the benefit of the city. So.
Well, so what I'll suggest, Mr. Chair, is that Patty and I will work, and we'll probably try to keep it to the same time frame here with the subcommittee with, as you say, the CBOs and the health providers like we did similarly before with Asmopolis, but we'll do this for to do more of the community wellness program and education with this particular product and see if we can get buy-in. We'll get the demonstration. Commissioner Harris already asked a couple of really good questions that we can have the vendor prepared to answer some of these questions here. And so if you have more questions you want to throw at us by the time we schedule the demonstration, we can certainly queue them up to be prepared to answer these questions as part of their presentation. And then from there, hopefully, because it may take a couple of meetings with the health providers, they see the demonstration, and they like we did with Asmopolis, we started vetting out, the pros and cons that make sense, and that may be another meeting we have with them. And ultimately, what I'd like to do is have this commission then go back to the city council, because at some point I could see the city participating if there is buy-in from the other health providers and some CBOs in terms of the financial costs, that the commission would go to the council and request that we participate in this program, essentially present what it is with an appropriation, because we do have some funding in this month's budget as we actually put it in for Asmopolis, so there is funding available for that we can use for this particular program as well. And so if we are on board with that, then we can go to the council, this commission can go to the council and make that presentation to the city council and saying this is where we would like to go to improve and strengthen our neighborhoods from the wellness, the health aspect of that.
Given the natural, holiday schedule between now and the end of the year, I think it would be prudent, given and our lack of attendance generally anyways, to take our December meeting off the calendar. Let's work with the commission's schedule, the CBO's schedule, the city's schedule. Let's plan a informational meeting with this group so we can get a presentation, and let's take the December meeting off calendar for those purposes. And then maybe we can hit it hard between now and the end of the year, and then by the January, February meeting we can start to work on some recommendations so that soon after that we could take it to the council. Because maybe it's not this program, maybe it's something more general education based, and we reach out to somebody that does something else. So,
Michelle, how many have you actually talked to some of the users of the program and gotten feedback or testimony from them on how it works, and was it worth it, and what were the hiccups they experienced?
We have references from users of the program, but a couple of years ago, did you get to that step before we applied for?
Yeah, I don't think we did. We do have references. We just haven't followed through.
Okay, because that's another thing I'd be real interested to bring to that meeting is get some, because if it's working as good as it looks like it's going to work, I think it'd be easy to get some of the users to give some real good testimonies as to what they were able to do. I mean, I saw the numbers where the amount of emergency visits decreased, but it'd be really nice to actually have more input from those organizations that have used it.
I agree.
I think the thing that stuck out to me the most about, we had been through 3 or 4 conversations. I think, at one point we had an informal conversation with Patty, Kelvin, and myself, and I believe one other commission member. Then we had a video presentation, and then we had them come out here, and then we had another phone conference. So we had like four scheduled planned meetings with Asmopolis, and then I remember Commissioner Harris asking the important question. Let's get down to the brass tacks. What is this going to save us? And then the representative on the phone kind of clamored around for a couple minutes, and then said, "Well, that's not what I'm not prepared to give you any of that information. I wasn't anticipating that question." I just remember thinking, well, what? That's what you're selling to us as a benefit. You've got to be able to quantify that benefit in order for us to be able to go to the community. And so, I think before we get to the 4th meeting, we need to figure out really truly what it is. Because I was completely shut off by their presentation. The second they don't have any kind of quantifiable data to show us, well, the data sets provided us this number of the benefit, and this is how they got to it. They really didn't have that. They just said, hey, we're going to be able to track all these things, generally speaking. So,
I think it would be great to, and probably give us a more realistic view, not only from the people who offer this program, but users, as mentioned, people who've been using it, maybe for some years, and to really get a sense of, because everything has its benefits and its challenges, and so to really hear from kind of the grassroots of people that are using it. Obviously, if they're still using it, they believe in it.
Right.
But there's going to be challenges with it too, and to know all of that before we, kind of count the cost before we go into it would be really great.
And it's a new program. There's nothing wrong with challenges,
right.
But at least know that the nuts and bolts of it works for what we want to use it for.
Right.
We could start working on that. We have a list of all of the agencies that are using it right now, so we could start working on and trying to get those interviews, and even maybe have some of those meetings when we're done getting a presentation from them. Maybe we could set up like a back-to-back meeting with somebody else that's actually using it, so they can kind of give us feedback on it as well as a group.
That sounds great, and it sounds like the right order to understand the people that produce it and that offer it, what they say it will do, what it can do, and on the benefits of it, and then to talk with people that are actually using it, and maybe we will be more informed about what questions to ask, and is this really working?
Maybe we should do it vice versa. If talk to the users first, kind of, and then so we know what questions also to ask.
Yeah, let's have a conversation with Cleveland. Let's have a conversation, maybe we should all take a trip.
Not Cleveland.
I've got family in Tennessee, though. I'd love to head back to Tennessee. So I've been
Minnesota.
I've always wanted to go.
Yeah.
There actually is a company using the program in California,
Yeah,
Providence.
right here in the Valley.
So
You just drive
we made
Yeah, you're in the Valley?
It's in North Hollywood.
Yeah.
Well, the map said it was real close to the ocean, so it's
Right.
Yeah, I
That may
think
be a
just
group
2
that
of the
we
Providence
can do.
groups just started using it, so I'm assuming 2 of the hospitals. I'm not sure the...
So Holy Cross, probably Providence. Holy Cross is Providence, isn't it?
Yeah.
Yeah.
I'm assuming it's maybe Holy Cross, and then, what's the North Hollywood, because that's San Fernando. But there's one in North Hollywood for sure, the Providence there. So,
Well, let's give notice. Let's take the December meeting off the calendar. I know we all love to be here, but if I could save the city some staff time and resources to turn the bright lights off in this room for an extra hour out of the month, I'd be glad to provide that to the city. And then let's task us to try to set up some more private conversations to educate us all, and then we'll come round back in January. Does the commission feel the need to put together a subcommittee to take on this task, or is it something we can do on a more of a team basis? I think so too.
As a team, we're going to wait for Patty and Calvin to gather more information, and then we have Michelle, and then we just get together as a team and dig into it.
Yeah.
I think what we can do is we can probably gather some information together before we actually set up a meeting, and that way you guys can, have some time to kind of digest everything and come up with the questions that you want to ask, come in prepared, and then that'll also give us some time to work with Providence and see if we can either have a meeting with them or set up some time to talk about what their experience has been like and just kind of go that route, so.
Yeah, that sounds good. I like.
Thank you, Michelle. I really appreciate the presentation.
Thanks for bringing it to us. This is right up. I think this is perfect, right up to where we needed to go. Lisa and I had a conversation this morning about we gotta light a fire under something and get some ideas going. I think this is a good way to start the conversation. So I'm excited. Okay. Any other questions for Michelle, or Patty, or Kelvin on this? Anything? No? Thank you. All right. Well, let's move on. Patty, give us the update. Tell us all that weren't able to be there, how Unite went.
I will. We're actually going to queue up a video. Let me. Oh, there we go. We're going to show a quick video of kind of some of the highlights of Unite, so you can see some of the projects that went on and smiling faces and people that were volunteering and things. No? Just double click. Okay, well. Sometimes technology doesn't work, so that's okay.
There it is.
Oh, there it is.
It's a little slower than...
It's on vacation.
She loves chess. Oh, man.
She will make everyone a chess lover. So just wanted to share a really quick video that our communications team put together. I thought they did a really good job with it. As you can tell, we had another successful program year with hundreds of volunteers and people participating in the different activities. Kelvin and I were actually able to go out to all the projects, and we really enjoyed seeing, the collaboration, the organization, and the effort that people put into these projects this year. So we're really glad to see that. It was really nice to see people of all ages working together. One of the projects that really stood out to me was the Desert View Beautification Project, where they did a cleanup at the school, and it was just really nice to see kids working together with their parents, their principal, and community volunteers to beautify their school. And it was more than just a day to hang out with their friends. It was really teaching these kids a life lesson, which is how important it is to give back to their community and to really take pride in their school. So it was a really good day. We want to thank you for all your support and guidance throughout the project, and we really look forward to building the project next year. And our Safer Stronger Neighborhoods Committee is already working on some different ideas and things that we can do for next year. So thank you, and we're glad we had another great year.
Yeah, thank you, Patty.
Sure. Oh. City staff updates?
Sure.
Okay. I just have 3 quick updates. First one is the Boulevard was recognized recently in a book called Completing Our Streets by Barbara McCann. The author talks about creating complete streets, which is basically cities and counties creating streets that are safe for pedestrians, motorists, bicyclists, where they can kind of coexist and be on the same street in a safe manner. She discussed the city of Lancaster and the Boulevard project because one of the things that she highlighted was how financially beneficial projects can be for cities. The Boulevard was once this basically a fast roadway that people just kind of drove through, nothing there to see, and now it's this really nice pedestrian downtown where people can come out, they can relax, they can shop. It brought in a lot of new businesses to the city, and really helped to just kind of grow our downtown and create a place for people here in the community. So I thought that was really interesting and a good book for us to read. The boulevard, another boulevard note is we actually garnered an award from the International Associations. It's actually from the Downtown International Association. We received their Pinnacle Award, and it's actually their top award for downtown management. We beat out 24 other organizations for that award in public space. And basically what it tells you is that, the Boulevard is really it's really a place that they see people should emulate, and they really see how valuable it has been to the Boulevard or to Lancaster, and how it can be that type of transformation can be really valuable to other cities. So it was a really important award to get. And then finally, inaugural Field of Drafts is this Saturday if anybody's interested. It's from 11 to 5 at the Municipal Stadium, Lancaster Municipal Stadium, and tickets are still available through the Parks and Recreation Department. You can either get your tickets here at City Hall, you can also purchase them online. We have over 40 breweries participating, and a lot of really good activities, so it's going to be a really great event, and hopefully we can see some of you there.
And I hear you're going to be volunteering to
I am volunteering, so stop by my area. Yeah, we're all pouring. Actually, it's a lot of city staff is volunteering for the event, so it's going to be a really good, nice event for the city.
Well, depending on how busy you want to be, you should pick one that's more obscure or not. Otherwise, you'll be
Otherwise, I'm going to be busy all day.
Pulling on that tab
That's right.
all night or all day. So, awesome. And there's also this weekend's also the MOA's party, correct? It's the MOA party, I think. Yeah. Party. Yeah. It's on Saturday, isn't it?
It's Saturday night, and it's at the MOA. Tickets are available now. It's a really good opportunity to see all the different exhibits that they have up, and to support the local arts. So great program, and it's welcome. It's open to the public. So if anybody's interested, they can contact City of Lancaster, the Parks and Recreation Department. They can also contact the MOA directly.
And it's also, I think tickets are $50 a piece, which is a heck of a bargain. I haven't been to a meeting,
a party
in the for any of these things in a while for less than 100. So that's good. And then today is election day, so if you guys haven't voted yet, go home and vote. It doesn't look like we have any business from the floor tonight, any public business from the floor, so I'll save my breath. Any other comments tonight from any commissioners?
Magical Boulevard, when is that?
December 9th. December 6th, I'm sorry. It's a Friday night, which is different. Usually our events are on Saturday, but that event's on a Friday night. It's from 5 to 9.
Awesome.
Okay.
And that's another great event for the family to come out. They have lots of great decorations set up, and the children can come out and visit with Santa.
What's what streets?
The street parameters. It's normally between Fern and I'd say Cedar Beach around there. But it may be different this year. There's always lots to see.
Yeah. Okay. Thank you.
Sure.
I just want to introduce our new service area public health officer, Dr. Alvarez, who's joined us tonight, which is so great. So he's going to be huge in helping us change the health of our community here.
Awesome. He was when we met at MOA. He came. So yeah, thanks for coming back.
Michelle, briefly, there was nothing to add. I think in terms of just he was very interesting in terms of the civic health.
Absolutely. Any other comments from the commissioners?
No.
I've got some great greens in my garden.
Do you? It's a great time of year for that. We can talk a lot about that.
Yes. Okay. I think we're good. We're good to go, right? Staff, anybody, anything else? Okay, we'll go ahead and adjourn the meeting at 4:57 or so.